Most people believe that diabetes can only be discovered through a laboratory blood test. You visit your doctor, the results come back, and that is the moment you find out. I understand why that belief is so common. For many years, it was the story most patients told me too. But after many years of working with older adults in clinical medicine, what I have come to know with real certainty is this. Your body begins communicating about elevated blood sugar long before any test is ordered. And the very first place it speaks, more consistently and more clearly than anywhere else, is your feet. I am Dr. Naira Stein. I want to share something with you today that I believe every person over 60 deserves to know. 9 specific warning signs that can appear on the feet months or even years before a diabetes diagnosis. Signs that most people explain away as ordinary aging, overuse, or dry skin. I will tell you what most people assume each one is, what is actually happening inside the body when it appears, and one daily habit that can protect you. Let me begin with a patient whose experience I think about often. He was 67 years old, retired, leading a reasonably active life, and feeling largely well. He came in for a routine appointment. Before we ordered any blood work, I asked him about his feet. He mentioned that they had felt a little numb for some time. He had assumed it was simply part of getting older. He had 4 of the 9 signs I am going to walk you through today. His fasting blood glucose came back at 214. He had been living with diabetes for more than 2 years without knowing it. The American Diabetes Association estimates that 1 in 5 Americans with diabetes has no idea. That is more than 8 million people whose nerves, kidneys, vision, and circulation are being quietly damaged every day by a condition they have not yet been told about. Today I want to make sure you know what to look for, so that if any of these signs are present on your feet or the feet of someone you love, you recognize them for what they are. Sign 1. Tingling or numbness that keeps coming back. Almost every patient I have spoken to about this sign has already experienced it, and almost every one of them has explained it away. A foot that falls asleep, pins and needles from sitting in the wrong position, and yes, occasional tingling from a compressed nerve happens to everyone from time to time. That is entirely normal. What is not normal is tingling or numbness that recurs frequently without a clear physical reason. When this becomes a pattern, when the feet feel strange or disconnected regularly, even without crossing the legs or sitting at an awkward angle, it deserves serious attention. Frequent, recurring numbness in the feet is one of the earliest detectable signs that blood sugar has been elevated for some time. The medical term is peripheral neuropathy, and it develops because excess glucose in the bloodstream gradually attacks the outer protective sheath of the peripheral nerves. I use this analogy with patients. Think of your nerves as electrical cables, each one covered in a protective insulating layer that keeps the signal clean and strong from the brain all the way down to the feet. When blood sugar remains elevated over months and years, it acts like a slow acid on that insulation. The cable still conducts for a while, but the signal begins to blur and distort. That distortion is the tingling you feel. The American Diabetes Association has found that peripheral neuropathy affects nearly half of all people with diabetes. It is the single most common complication of a condition, and it almost always begins in the feet. The daily habit I recommend for this sign is a 20 to 30 minute walk every single day. Not a jog, not an exercise class, simply walking. Sustained movement is one of the most effective ways to maintain blood flow to the peripheral nerves of the feet. Begin reducing added sugar from your diet today, not gradually over the coming weeks, but starting with your very next meal. Sign 2. A burning sensation in the soles, especially at night. This is the sign that my patients describe as the most distressing, partly because of how uncomfortable it is, and partly because of when it tends to arrive. It does not happen during the busy hours of the day when there are distractions. It comes at night, when the house is quiet and there is nothing between you and the sensation. Patients describe it as heat rising through the soles of the feet, a warmth that has no external source. Some say it is enough to disrupt sleep entirely. The most common explanations people reach for are spending too much time on their feet, the warmth of summer, or simply tiredness at the end of the day. Sometimes those explanations are correct, but when a patient tells me their feet feel as though they are burning from the inside, particularly at night when they are lying still, I take that very seriously. What is happening is this. The nerves in the feet have been damaged by sustained high blood sugar, and they are now sending incorrect signals to the brain. The brain receives a message that says heat, even though nothing warm is touching the foot. The nerves are misfiring, transmitting alarm signals from tissue that has been compromised. I sometimes describe it as a fire alarm with a faulty sensor. The alarm is sounding, but the building is not on fire. The sensor itself is damaged. Research published in the journal Diabetes Care has found that burning foot pain is among the earliest reported symptoms in people who are later formally diagnosed with type 2 diabetes, often appearing 1 to 3 years before that diagnosis is made. For this sign, I recommend 2 daily habits. First, drink at least 8 glasses of water each day. Adequate hydration supports the kidneys in clearing excess glucose and helps maintain nerve tissue health. Second, add fiber to every meal. Vegetables, legumes, oats, because fiber slows the rate at which sugar enters the bloodstream, giving the already stressed nerves a more stable environment. Sign 3. A small wound that simply will not heal. This is a sign I want you to pay the closest attention to of all 9, because it is the one that crosses the line from uncomfortable to genuinely dangerous. Patients come to me, or in too many cases are brought to emergency care, with a story that goes like this. There was a small blister from a shoe, or a minor scrape, or a cut that seemed trivial. They waited for it to heal on its own. 3 weeks passed. 4 weeks. It did not close. Most small wounds on healthy skin heal within days. When blood sugar is chronically elevated, the body loses a significant portion of its ability to carry out that repair. The tiny blood vessels throughout the feet and lower legs narrow and stiffen over time, reducing their capacity to deliver the oxygen, white blood cells, and repair nutrients that wounded tissue depends on. The wound sits open. The circulation it needs to close simply cannot reach it in sufficient volume. I explain it to patients this way. Imagine trying to water a garden through a hose that has been severely kinked. The water exists, the source is there, but it cannot travel where it needs to go. The flowers sit parched while water sits unused in the pipe. That is precisely what impaired circulation does to a wound on the foot. The healing resources exist in the blood, but they cannot arrive. And an open wound that cannot close is an invitation to infection. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, accounting for more than 100,000 procedures each year. In almost every case, the story began with a small wound that was dismissed. Tonight, after your bath or shower, sit down in good light and examine both feet carefully. Look between every toe. Look at the heel and the sole. If you find any cut, crack, blister, or broken skin, clean it with mild soap and warm water, apply an antiseptic, and cover it. If it has not improved within 48 hours, call your doctor. Not at your next scheduled appointment, within 48 hours. Sign 4. Darkening or reddish discoloration around the ankles. This sign is visible. It has often been present for a long time, and almost nobody connects it to blood sugar. Patients point to the darkened skin around their ankles and tell me it has always been that way, or that they assumed it was sun exposure, or that their skin has simply always been darker in that area. Any of those explanations may be accurate, but there is a specific pattern of discoloration, particularly a deep reddish or dusky darkening around the ankles and lower legs, that I look for specifically when assessing blood sugar risk in older patients. When circulation is compromised by sustained high blood sugar, the lower legs and feet receive insufficient amounts of fresh, oxygenated blood. The skin changes in response. A deep reddish or purplish tint, or a general darkening that worsens over time, reflects tissue that is not receiving the blood supply it needs. In some patients, the skin also becomes noticeably thinner and more fragile in those areas, another sign that the underlying tissue is being inadequately nourished. I describe it to patients as a distress signal written on the surface of the skin. The feet are the furthest point in the body from the heart, and when the delivery route, the blood vessels, narrows, the destination shows the consequences first. A study published in the Journal of the American Academy of Dermatology found that these visible skin changes in the lower extremities are detectable on average 18 months before a formal diabetes diagnosis is made. The daily habit for this sign is 5 minutes of gentle ankle circles, toe raises, and calf stretches each morning before you begin your day. Even a small amount of deliberate movement drives circulation into the feet and lower legs. If sustained movement is difficult, elevating the feet slightly while seated can also support blood flow. Sign 5. Persistent heel cracking that no moisturizer can reach. I have heard this one from more patients than I can count. My heels crack every winter. It is just dry skin. I have tried every lotion. And yes, dry, cracked heels are extremely common and for most people represent nothing more than a skincare issue, particularly in cold and low humidity months. But when the heels are cracking severely in the middle of summer, or when moisturizers applied consistently for months produce no lasting improvement, the picture changes completely. Diabetes affects the autonomic nerves, the nerves that govern automatic, unconscious body functions that we never have to consciously direct. One of those functions is the regulation of moisture and perspiration in the skin of the feet. When these nerves are damaged by chronic high blood sugar, the sweat glands in the feet stop receiving the signals they need to function properly. The feet lose their natural moisture from within. No amount of lotion applied from the outside corrects this, because the problem is not the surface of the skin. It is the nerve signal that should be maintaining that surface from the inside. Think of the skin as a wall that depends on a structural binder to stay intact. When the autonomic nerves are damaged, that binder begins to crumble. Cracks appear, and those cracks in the skin of the feet are not cosmetic inconveniences. They are openings through which bacteria can enter, and in feet that already have poor circulation, an infection that enters through a cracked heel can become serious far more quickly than most people anticipate. The American Podiatric Medical Association identifies persistent, difficult-to-treat heel cracking as a significant indicator of autonomic neuropathy, nerve damage caused by long-term elevated blood sugar in older adults. Moisturize your feet every night before bed, paying particular attention to the sole and heel. A plain, unfragranced lotion or pure coconut oil works well. One important detail: never apply moisturizer between the toes. Trapped moisture in that area creates the ideal conditions for fungal infection. And drink at least 8 glasses of water daily. Your skin requires internal hydration as much as external care. Sign 6. Consistent swelling in the feet and ankles that leaves sock marks. Occasional foot and ankle swelling is something many older adults experience and reasonably attribute to long hours on their feet, warm weather, or simply a sedentary day. That explanation is often correct. But there is a pattern of swelling that deserves a different kind of attention. Feet and ankles that are consistently swollen by the end of most days, that leave visible indentations from socks or shoe straps, and where pressing a finger into the swollen tissue leaves an impression that takes several seconds to refill. That pattern is called pitting edema, and in the context of the other signs we are discussing, it points towards something more systemic than a long day of standing. High blood sugar damages the kidneys over time, and the kidneys are responsible for regulating the body's fluid balance. When kidney function is impaired by years of elevated glucose, the filtration system begins to back up. Fluid that would ordinarily be processed and removed accumulates instead, and gravity directs it to the lowest available point in the body, the feet and ankles. The swelling you see and feel is the body's fluid balance being disrupted at the level of the organ responsible for maintaining it. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and that lower extremity edema is frequently the first visible sign that kidney function is under stress. When you rest during the day or at the end of the evening, elevate your feet above the level of your heart. Even a few inches on a cushion or pillow makes a meaningful difference in helping accumulated fluid return toward the body's center. Reduce sodium in your diet. Salt causes the body to retain water, which significantly worsens edema. Read food labels carefully, as canned and processed foods are often far higher in sodium than people realize. If the swelling is new, is getting progressively worse, or appears alongside any other symptoms, bring it to your doctor's attention promptly. Sign 7. Sharp, electric, or stabbing pain in the feet, often mistaken for arthritis. This is the sign I see most frequently misidentified, and in my experience, it is particularly common among older men who have been managing the pain independently for months or years by the time it comes to clinical attention. The story is usually the same. They have been taking over-the-counter pain medication for what they assumed was arthritis, a previous sports injury, or the natural wear of a life spent on their feet. The medication dulls the pain enough to function, so they continue. By the time I see them, they have often been masking a signal their body has been sending persistently for a long time. When nerves are damaged by chronic high blood sugar, they do not always simply go quiet. In some people, they become hyperactive, firing intense, random signals that the brain interprets as severe pain. Patients describe it as a stabbing sensation, an electric shock passing through the foot, or the feeling of a hot needle. It tends to be worse at night, when there are no other sensory signals competing for the brain's attention. I sometimes use this comparison. Imagine a car alarm that was triggered in a minor accident. It goes off every few minutes without any cause. No one is near the vehicle, nothing is wrong with it, but the alarm keeps sounding because the sensor inside it is damaged. That is what a nerve affected by diabetic neuropathy does. The pain is entirely real, but its source is not injury or inflammation. It is a damaged nerve sending alarm signals from tissue that is under metabolic stress. A landmark study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 1 in 4 people with diabetes and is routinely mistaken for arthritis, tendinitis, or age-related joint degeneration. Taking pain medication for this symptom manages the discomfort but does nothing for the underlying nerve damage. And while the pain is quieted, the process causing it continues. Each morning before getting out of bed, spend 5 minutes in gentle foot and ankle movement. Flex the feet, circle the ankles, draw the toes back slowly. Getting blood circulating before putting weight on the feet makes a genuine difference. Each evening before sleep, give both feet a gentle self-massage using slow circular strokes along the sole and up the ankle. 5 to 10 minutes of light pressure that supports circulation through the night. Sign 8. Feet that stay cold. Regardless of the temperature around you, nearly every patient who has this sign has the same response when I raise it. They laugh and tell me they have always had cold feet, that their partner has complained about it for years, that they need extra blankets regardless of the season. And I laugh with them, because it is a familiar story. But then I ask the question that changes the tone of the conversation. Are your feet cold in July? Are they cold under 3 blankets when the rest of your body feels warm? Because that is a different matter entirely. Cold feet that persist without regard for external temperature. Cold in summer, cold under heavy covers, cold even when the hands and body feel comfortable, are a strong indicator of significantly compromised blood circulation in the lower extremities. When blood vessels narrow and stiffen over years of elevated blood sugar, warm blood simply cannot reach the feet in adequate volume. The feet stay cold not because the environment is cold, but because the delivery system is impaired. I describe it to patients this way. Think of your circulation as a heating system, with pipes running to every part of the house. When those pipes narrow, the heat cannot travel the full distance. The rooms at the far end of the system stay cold, no matter how hard the furnace works. The problem is not the furnace, it is the pipes. The American Heart Association identifies peripheral artery disease, the narrowing and stiffening of blood vessels in the legs and feet, as affecting more than 8 million Americans, with diabetes being the single largest contributing risk factor. Persistently cold feet are among its earliest and most consistent early signs. The most effective daily response to this sign is a purposeful 30-minute walk, not a gentle stroll, but a brisk, intentional walk with active arm movement. This type of movement forces circulation into the feet and lower legs, challenges the blood vessel walls in a way that strengthens them over time, and has been shown to produce measurable improvements in peripheral blood flow with consistent practice. If 30 minutes feels too ambitious, begin with 10 and build from there. The most important thing is that you begin. Sign 9. Absent or thinning hair on the lower legs and tops of the feet. This is the sign that almost nobody ever mentions, not in patient brochures, not in general health conversations, and rarely even in clinical consultations unless a doctor is specifically examining the feet with this in mind. It is quiet and easy to miss. Most people have simply never looked for it. But once you know what to look for, it becomes one of the most telling, visible indicators of long-standing blood vessel damage. Hair follicles, like every other living structure in the body, require a consistent supply of blood and oxygen to function. When circulation to the lower legs and feet is significantly compromised by years of elevated blood sugar, the hair follicles in those areas gradually stop receiving what they need. They do not die abruptly. They simply slow down and eventually stop producing hair altogether. The result is a visible patchiness or complete absence of hair on the lower legs and the tops of the feet, often in contrast to the hair present on the upper legs and the rest of the body. Patients who notice it for the first time during a foot examination frequently say they had simply never looked closely enough before. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in people with diabetes. It is a reliable, visible marker of blood vessel damage that has been developing, in most cases, over a period of years, and it is specifically included in the clinical foot examination that doctors are trained to perform. After finishing this script, look at your lower legs and the tops of your feet in good light. If the hair in those areas is noticeably thinner than the rest of your leg, patchy or absent, schedule a fasting blood glucose test this week. Not this month, this week. A blood glucose test is inexpensive, widely available, and covered by Medicare for the majority of older adults. The information it provides can redirect the entire course of your health. What to do tonight and what comes next. We have covered 9 signs, 9 visible, feelable, recognizable communications that the body sends about elevated blood sugar, sometimes years before a formal diagnosis is made. Each one is easy to miss. Each one has a more comfortable explanation that most people reach for automatically. And each one, if recognized for what it actually is, represents an opportunity to act early, when the outcome is most fully within reach. I want to be honest with you about something. One of the heaviest conversations I have in clinical practice is sitting with a patient who has had every one of these signs for 2 years or more, and is only now learning what they meant. Not because they were careless. They cared deeply about their health. They simply did not have the information. You now have it, and I want you to use it in one practical way tonight. Before you go to sleep this evening, sit down in a well-lit space and look at your feet. Spend 30 seconds. Look at the skin color, particularly around the ankles. Look between the toes and along the heel for any unhealed break in the skin. Notice whether the soles feel any tingling or numbness when you press them gently. Look at the lower legs and the tops of the feet for hair that should be there but is not. 30 seconds. That is all I am asking. If you recognize one or more of these signs on yourself, please contact your doctor this week and ask for a fasting blood glucose test. If you find any open wound, cut, or blister that is not healed within 48 hours, call your doctor before that 48 hours is up. These are not alarmist recommendations. They are the kind of attentive, timely responses that allow a manageable condition to be caught and addressed before it reaches the stage where the options are fewer and harder. In most cases, blood sugar caught early can be meaningfully managed through changes in diet, consistent daily movement, and a thoughtful conversation with a doctor. The people who do best with this condition are not the ones who had the least severe cases. They are the ones who paid attention early and acted on what they noticed. The feet are, in a very real biological sense, the body's frontline reporters. They are the furthest from the heart, they are served by the smallest and most vulnerable blood vessels, and they are innervated by the longest peripheral nerve fibers in the body. When the internal systems that maintain blood sugar, circulation, and nerve health begin to falter, the feet are among the first places that change becomes visible. Not because the feet are particularly fragile, but because they are particularly sensitive to the conditions that high blood sugar creates. The 9 signs we discussed today, tingling and numbness, burning pain at night, wounds that will not heal, discoloration around the ankles, persistent heel cracking, ankle swelling, sharp or electric pain, permanently cold feet, and absent hair on the lower legs, are not a checklist of misfortune. They are an invitation to look more carefully, to ask better questions, and to give your body the informed attention it has been asking for. I am Dr. Naira Stein. Thank you for spending this time with me. The health you have built over a lifetime is worth protecting with the same care and attentiveness that built it. Pay attention to what your feet are telling you. The information is there. Now you know how to read it. Take good care of yourself and of those feet. I will see you in the next one.